Hello, class. My name is Raul Posadas, and I'm here to talk about interesting facts and observations that I made while reading this chapter. So, to start off with chapter 3, preparing program goals, um, one important fact that I saw was that numerous surveys actually have indicated that for program directors, planning may be their most time consuming and challenging tasks. So, therefore, their planning methods must be fundamentally sound and tailored to address the unique needs and interests of the prospective work sites. So, um, as you prepare strategies to deal with the needs and interests, one must first accurately determine this following bullets. So, to start off, um, we should first identify the prevalence of the issues identified in the work site, the immediate and long-term effects of these issues on employees' health and on the job productivity, probable contributing factors, demographic, occupational, cultural, environmental, and economic, and the group of workers that have the greatest risks. So all of these are factors and things that we should already keep in mind before starting with the program. So once we're on with this information, you can now proceed through the several important steps, which are as follows. So first, establishing a vision and mission statement, setting appropriate goals for the program, making program and resource decisions, funding and budgeting the program, deciding whether to establish an integrated program, um, such as within the department, such as human resources. That's a great example, and most programs actually have that. Most work sites have that. And six, incorporate reliable methods to evaluate the worksite promotion program. Okay, so establishing vision and mission statements. Each organization has its own unique way of sustaining business functions for success. So some questions that we can be used to achieve this goal can include the why are we doing this? Why are we offering that particular product or the service? How are we serving the needs of our customers? With whom are we partnering to provide the service? Who is responsible for each phase of the product development and marketing and delivery? And well, by answering these preceding questions, the program planners will have a better understanding of how their organization functions as they proceed to their work. So, with that said, now we have to set appropriate goals for their program. So it is important to set and develop goals relevant to the scope and specifically of your target population. So goals that clearly reflect the scope of key Socratic elements should be SMART: specific, measurable, attainable, realistic, and timely. Um, those are the basic elements for the goals. I mean, they have the most efficiency. So, measurable objectives. Once program goals have been developed, it is important to establish measurable objectives. Objectives are stepping stones or rungs in a ladder that enable program planners to achieve a particular goal. They establish short-term objectives. Establishing short-term objectives for monitoring progress in an initial phase. Establish long-range objectives to determine whether initial levels of progress have been sustained. Avoid the temptation of establishing a long list of objectives. Too many objectives can add unnecessary procedures, so we also don't want that many objectives. And also it costs more money to evaluate and to have more evaluations on the employees. Fourth, include objectives that identify specific resources needed to achieve the goal. And finally, specify timeframes when appropriate. So also we have to keep in mind that we have to have anticipate realistic results. We also don't want to anticipate results that we know that are not going to be achievable. So assuming appropriate goals have been set for the first place, the best way to evaluate a program success is to compare the results with its goals. Results cannot be judged until the program has been completed. So obviously we cannot start with the results before. So to wrap up chapter 3, we have to clearly define goals and objectives are essential for effective worksite health promotion programming and evaluation. Worksite health promotion goals should be specific, measurable, attainable, realistic, and tight. Remember, SMART. Objectives should always be measurable and directly relatable to major tasks, and evaluation methods should be considered when planning program goals. Okay, now moving forward really fast for chapter 4. I don't have too much like chapter 3, but some stuff that I really want to go over with you is that in order to make a sound program decision, first we need to take time to understand the needs and interests of the population, assess the resources, and determine what types of incentives and activities an ongoing program will yield the highest and dividends for managing employee and organizational health. So, one of the pressing challenges for worksite health promotion practitioners face today is how to motivate employees to actually do the exercise in the first place. The percentage of inactive adults exceeds the percentage of inactive. So, meaning that more people that are inactive, that there's more people that do not exercise than with the people that do exercise, and that's something that really has to change. So, growing evidence that regular exercise can reduce the risk of heart disease. This is something that can motivate them. Another thing that motivates people to actually do exercise is by increasing the evidence of direct relationship between physical activity and the job productivity. We can tell them how being healthy and how doing activity actually helps in their productivity. Growing financial stress due to paying billions of dollars to treat employees in illness. And greater publicity on the profound financial effect of physical inactivity on their actual healthcare and productivity costs. So we can tell them how being inactive is actually going to affect them in their health insurance and all that. Then something else Okay, now going to weight control, because this is one of the most important things that to me is that over one half of all workers are overweight or obese, and about 2/3 of all workers eat unhealthy diets. A high-fat diet is a major risk of factors for problems associated with many health claims. Obese employees have significantly longer hospital stays and higher healthcare costs than their co-workers. And actually, weight control is a prime target area for worksite health promotion, just like I said. Many worksite health promotion personnel choose to integrate nutrition education and weight control information into a single program. Another interesting fact that I found here was the back health. Back injuries is one of the most common injuries in the worksite and is the primary cause for absenteeism in every company. That's something that I didn't actually know. I thought it was most like people faking that they're sick and stuff like that, but it's actually back injury is the most common cause for absenteeism in workforce. Another thing that I really like and I want to emphasize a lot is the smoking control. One of the most visible examples of corporate and commitment to employees' health is reflecting the growth of smoking control and policies at many work sites. So there's actually an estimate of 420,000 deaths each year to cigarette smoking, making it one of the nation's leading causes of preventable death. That was back in 2004. So now with a little bit more knowledge on smoking, I'm pretty sure those go down. But I mean, we can make it even go down by keep moving forward with this standard of getting rid of smoking, because also exposure to secondhand smoking can cause disease and premature death to non-smoking children and adults. So we have to think about the environment as a whole and not just one person. And then also medical self-care and healthcare consumerism. So the average person in the United States sees a doctor about 5 times a year and takes about 7 different prescriptions per year. Yet at least 80% of all outpatient physicians visit for new health problems are essentially unnecessary. So meaning that most of the times that people go to the physician are stuff that could be self-treated. So there's no need to have gone. So fewer than 30 different conditions account for as much as 90% of physician visits. And many of them are actually conditions that can be preventing and with medical self-care interventions. So and reports for Worksite using medical self-care and consumer education interventions indicate that they actually save $3 or more for every dollar they actually spend. Um, so now just to wrap it up, I wanted to say that the overall level of success achieved by a particular World Health Promotion program depends on the ability of worksite health promotion practitioners to strategically align supply side resources to the specificity of the demand side needs and interest of the employees. All right, thank you.